Well, for children's services initially it was related to the high incidences of DNA in our children's population, and they were persistent, and it was particularly high for Pacific and Māori children. So when we became interested in this whole notion of health literacy and had a look at some of the literature, one of the things that we discovered was that 56% of adult New Zealanders do not have sufficient health literacy to make simple healthcare decisions. So then we thought, well, what does that mean for their children and what does it mean for the whole family? So I got really interested in the idea of making a difference for children and families in our environment.
We were able to take an organisational approach. We believe it was everybody's responsibility, so we were keen to look at the layers that were outlined in the guide and looked at what we did and how we did it better in regards to our communication and interaction with our patients.
Part of our role in patient administration is we book what we call a first specialist appointment for all paediatrics, or all services within the DHB, but specifically for paediatrics we found that giving good clear communication was going to be a benefit for children and parents, as they often don't understand what paediatrics means, or what we use a lot of terminology like FSAs, DNA, so it was making sure that the communication was clear and easy for them to follow.
We found out that families were unsure about why they were actually referred to our service, and we found out that often referrals were very unclear from GPs. We found out also that families didn't realise the consequence of them not turning up to an appointment. They didn't actually have any sense that it would cost the organisation anything, or it may actually even waylay the time that it took to see us. So what we've instigated is a program called ABC, which is Ask, Build, Check, and that is all about eliciting the understanding of families in relation to the particular reason that they're in hospital for.
I think as an organisation we had an appreciation of the fact that we don't make things easy for patients who access our services, and we also know that understanding or lack of understanding of what is wrong with you can lead to patients making uninformed decisions and not necessarily for taking the course of action that they should. So this presented an opportunity to underpin some work we were already doing and adding another depth to the work that we were doing to improve access for our patients. We know that our population is quite diverse, and we had been doing quite a bit of work with our Māori Health Directorate looking at how we could improve disparities and inequalities, and some of the work that we have been doing has clearly demonstrated that at a global level we've improved services and access to services for patients, but when you look at it from either a Māori or Pacific point of view, that those inequalities and disparities still exist. We already had a big piece of work occurring in relation to our did not attend rates, and for a number of years had been looking at a lot of strategies to reduce that level of did not attend. Where we had got to was we needed to take a wider organisational view to identify some of the systemic issues, or what might be some of the underlying systemic issues. So we thought that it was a really good opportunity to bring that in and increase the breadth of our focus on the DNA project, and look at it from another viewpoint really, to address some of those underlying issues, which you know intuitively, but until we did the review, we actually then had the facts that supported what we had thought intuitively. The work that was completed confirmed some of the issues that we thought we had an understanding of, but it really highlighted for us that you think as an organisation which is large and complex, and as health professionals, we are doing the best we can for our patients, and that's certainly the intention behind everything that we do. However, the different language that we used, whether it be in primary care to the patient, primary care to secondary care, or once the patient comes into our secondary care services, between secondary care service providers and the patients, the language is quite different. And we're also not very good at checking for understanding. So it gave us an opportunity to really look at the services that we do provide, how we provide, what information we provide to patients before they come into the hospital, how easy it is to navigate through our physical facilities, and also then what to do after an appointment and how to access or go on to access other services that they may need. I can see that some of the findings from the review will help steer the organisation as to where we now want to focus our efforts going forward. If you look at the environment that we do try to provide at Capital and Coast District Health Board for patients who use our services, it is an environment that is supportive and provides the right services to the right patients at the right time. And I think this will help inform where we might need to develop our navigation services, for example. In the past we've put in navigation roles because there's been a perceived need. I think we'll now be able to really focus those positions and look beyond them as to what we need to do from an organisational point of view around staff education in general, around health literacy. We have all sorts of patients accessing all of our services, and there are inherent issues with health literacy, I believe, across the board. And if we can apply even half of the learnings from this review to the rest of how we deliver our services, then we'll be making a huge impact on health literacy overall, and therefore access to services, and therefore patient outcomes as the ultimate goal.